Hello, my name is Ellie Sung, and today I'll be presenting my research titled Domestic Dogs as Sentinels for Lyme Disease, a One-Health Approach. Just to share a little bit about myself, I'm a student at Ursuline Academy of Dallas, and I've always been interested in animals. This interest led me to this project where I looked into how domestic dogs can actually help us track and prevent one of the fastest growing vector-borne diseases in the United States, Lyme disease. Here are some questions to consider throughout my presentation. How can we utilize domestic dogs as sentinels for Lyme disease in regions with high prevalence? And how can we initiate collaboration between veterinarians and public health departments? So, Lyme disease caused by the bacterium Borrelia burgdorferi is the most common vector-borne disease in the United States, and is transmitted through Ixodes scapularis, which is known as the black-legged tick. In recent years, cases have risen dramatically. The CDC, also known as the Centers for Disease Control and Prevention, reported over 60,000 cases in 2022, which was a 68% jump compared to the annual average just a few years prior. And in 2023, just a year later, there were over 80,000 cases. So clearly, this isn't just an isolated problem anymore. It's growing, it's spreading geographically, and it affects not just animals but also humans. So this raises the big question. How can we detect and respond to Lyme disease earlier before human cases increase in new regions? To get a sense of this expansion, here are some of CDC's Lyme disease maps over the years, alongside with the Companion Animal Parasite Council, also known as the CIPC, which tracks infections in dogs. You can see how in both maps for humans and animals, you can see how clusters in the Northeast and Upper Midwest gradually spread outward. And this is really interesting and what's really interesting is that in many cases, dog data showed risks in new counties right before human cases were officially reported. That's what sparked my focus on dogs as sentinel species, essentially their early warning systems for disease risk. So you might be asking, why dogs? Well, there are around 68 million households in the US that own a dog, and this means that they're everywhere, rural, suburban, urban environments. Dogs spend more time outdoors, often in the same environments as their owners, and are exposed to ticks whether or not they develop symptoms. And most importantly, dogs often go to the vet annually for checkups where they're routinely tested for tick-borne diseases. This gives us a massive data source which can tell us about tick activity and pathogen presence long before humans in that same area are diagnosed. Research has shown a clear correlation between canine Lyme disease seroprevalence, which just means the percentage of dogs that test positive for exposure, and human Lyme disease cases. For example, studies show that when canine seroprevalence is around less than 5%, human incidence is almost zero. Just so they follow each other. But once you get above that threshold, human risk actually skyrockets up to 100 times higher. But another study in the New York City metropolitan area, they found that dog test data could explain 65% of the variation in human cases across counties. And this is a powerful predictor. So by looking at dog test results, we can essentially map environmental risk for people. Here's where this gets very practical. The CAPC, which I showed in earlier slides with the orange map, publishes interactive maps that use millions of dog test data from across the country. Veterinarians can use this data to warn pet owners about the risks, and public health departments can use them to anticipate new hotspots. And the technology is only improving. For example, Cornell University developed the Lyme multiplex assay, which distinguishes between vaccination antibodies and the actual infection. This is important because it prevents false signals and makes sense of the data even more accurate. On the right are the three proteins they test for. OSPA, which tests for the vaccine, OSPC, the early infection, and OSPF, the chronic infection. This test is helping us tell apart between vaccinated dogs and infected dogs. And this is really important because older tests weren't able to separate the dogs that were just vaccinated and the dogs that were just actually sick. So now, it's not just about domestic dogs that can teach us about Lyme disease. Wild canines like coyotes and fox can as well, because they also carry tick-borne pathogens. In California, for instance, nearly 40% of coyotes tested positive for B. burgdorferi, which is the bacterium for Lyme disease, and these patterns shift with rainfall, habitat type, and climate. And by studying along these wildlife animals alongside domestic dogs, we can see how pathogens circulate in ecosystems, cross into domestic animals, and ultimately impact human populations. It's a bigger picture approach that helps us prepare for emerging risks. Now, this brings me to my key theme of my research, the One Health framework. One Health is about recognizing that human health, animal health, and environmental health are all interconnected. Lyme disease is a perfect example of this interconnection. Veterinarians are on the front lines. They often see rising tick activity before human cases even appear. If their data is shared with public health departments and combined with environmental monitoring, it creates a much more stronger surveillance system. And this kind of collaboration fills the gaps left by traditional human only reporting, which we know is very underreported and inconsistent since it's voluntary. Of course, there are limitations. Not all dogs are tested equally. Some vets only test symptomatic dogs, which can skew the data. Reporting is voluntary, so there are many geographic blind spots. And antibody tests can't always distinguish between past exposure and active infection. Another issue is that human and dog data sometimes plateaus. That means after a certain level of dog exposures, human cases don't keep rising with it. We don't fully yet understand why. It could be related to immunity, differences in reporting, or ecological factors. So while dogs are powerful sentinels, their data has to be interpreted carefully and combined with human and environmental surveillance. So, here are some future solutions that we should focus on. Developing standardized testing reporting systems for canine and Lyme data, studying ecological factors like climate and land use that affect tick populations, integrating canine data more directly into public health planning, and even leveraging new vaccine technology. Since for the over the past 20 years, there has not been a human Lyme vaccine and hopefully there will be, but ultimately, dogs give us a tool for early warning and prevention. By connecting veterinary data, human health systems, and environmental monitoring, we can build a much more proactive defense against this growing threat. So, to wrap up, my research shows that domestic dogs are more than just companions. They're also a sentinel species that can protect communities by signaling risk before human cases rise. By applying this One Health approach, uniting veterinarians, physicians, researchers, public health, we can strengthen surveillance, respond faster to emerging hotspots, and protect human and animal health. Thank you. Here are some of my resources, and if you have any questions, feel free to contact me at this email.